again, so I don't forget. And then I have some music I'm just going to share as people come into the room. Can you just let me know if you hear this music?
Yes.
Okay. Okay, good morning, good afternoon, depending on where you're all joining us from. You're all very welcome to our Startup Women's Industry Advisory Circle for Women in Health. I'm Isabel Nolan. I'm the Program Manager for the Startup Women and Startup Global programs at Startup Canada. I'm just trying to let everyone in as I go through my opening remarks. But to begin, I would like to acknowledge that the land on which I'm on today is located on the unceded and traditional territories of the Musqueam, Squamish, and Tsleil-Waututh nations, also known as Vancouver. I also acknowledge with respect the diverse histories and cultures of all Indigenous peoples. I encourage you to take a moment to acknowledge the traditional territory that you're residing on today. Today's session is being recorded, and we will be adding it to our resource guide along with any resources shared during today's session. So a little bit about Startup Canada. If you're not familiar with us, we're a national nonprofit that's the gateway to Canada's entrepreneurial ecosystem. We're here to connect entrepreneurs with the support, community, and tools that they need to build a successful business in Canada. Since launching in 2012, Startup Canada has grown to support more than 130,000 entrepreneurs annually and an ever-growing community of ecosystem partners from coast to coast to coast. Dedicated to showing up for women all year round, Startup Women is an annual program offering support for early-stage women identifying entrepreneurs across Canada through topic-focused webinars, industry advisory circles like this, and meetings with startup women leaders. We know that when you support women, you support a nation. These monthly industry advisory circles will provide you, the attendees, with a deeper understanding of trends and best practices within your sector and leave with some actionable takeaways and resources that you can implement into your business. I'd like to take a moment to introduce Rowena Sang. She's the segment director at UPS Canada, and UPS Canada have been one of our longest standing supporters throughout the years, and they joined the Startup Women program as a co-presenting partner. So I'll invite Rowena to say a few words.
Thank you. So hello, everyone. As Isabel mentioned, my name is Rowena Sang. I'm the segmentation director for UPS Canada. And as you know, UPS is well involved with the healthcare, and it is a major cornerstone for us. In the last few years, our investment was focused on 6 areas: cold chain, clinical advanced therapies, labs and diagnostics, pharma, home care, and medical devices. As you know, the healthcare supply chain, or health chain, we call it, is very complex. That is why we continue to invest in new technology and infrastructure to reduce the complexities. Our healthcare chain is supported through integrated networks, managed transportation, customs brokerage, healthcare logistics and distribution, and ocean air freight. But let's talk about some specific advancements that we have made for our healthcare providers, especially in Canada. Since 2021, UPS Canada has launched a UPS Premier service that is designed for time or temperature sensitive shipments. It's a white glove service with 24/7 monitoring and tracking capabilities, along with intervention, putting these packages in the fast lane. Furthermore, many providers are leveraging our final mile delivery solutions to help improve the patient experience, leveraging My Choice, which empowers the patient to design the delivery experience, to access points, a safe haven for products that needs to be protected from changing climates. And now with Saturday delivery and the coming of Follow My Driver and 2-hour delivery window, patients, technician, nurses will get their package faster with real-time transparency. To give you a sense on how we've helped using some of the solutions I have mentioned, I'll provide you with a link to a case study we actually have for a customer called Panthera Dental, located in Quebec. They're committed to designing and manufacturing custom-made dental restorations, sleep breathing disorder solutions, and products. So check out the link. I'll provide that in the comments. And then if you have any questions, please reach out. And as you venture forward, know that we are here, obviously, to help. We believe that we've taken our best and made it better, and we can definitely help you to be quality focused and patient driven. So I thank you all for letting me speak today, and I hope you enjoy today's session.
Fantastic. Thank you so much, Rowena, and thank you so much for joining us today. Another quick shout out to our other co-presenting partner, the Scotiabank Women Initiative, our program partners, EDC, Mastercard, and YSpace, and our community of ecosystem partners, which I've shared a full list of in the chat. Without any of their support, this program just wouldn't be able to happen. So a massive thank you to our partners. So I know a few people have joined since we started. So today's session is for women in health, and I'm very excited to dive into this discussion. So to take you through what the next sort of hour and a half or so will look like, in a moment, I'm going to ask each of our attendees to do a quick introduction of themselves. You can either do this on camera or in the chat. If your camera is on, I'll assume that you're comfortable with introducing yourself, and I'll sort of start calling out names that I see on screen. So let us know your name, where you're located, maybe a quick sentence or two about your business or what you're looking to get out of today's session, so that myself and the speakers can better understand how we can serve you today. And we'll then move on to our entrepreneur expert talk. So we have two wonderful speakers today. So they'll sort of take us through their journey in getting into the health space. And then we have some questions for our panel discussion segment. And I've drafted out a few, but these sessions are for you, the attendees. So I will give priority to any questions that you have. I see a few more people are coming into the room as well. So if you have a question for our speakers, you can use the raise hand function and come on screen and ask a question. Or if you're more comfortable doing it into the chat, and I can ask on your behalf. But I always say it's a good sign of a great session when we hardly get to the questions that I've drafted out. So no question is too small. So please feel comfortable in asking anything that you'd like to our speakers today. And then our final segment of this session will be our networking breakout rooms. So I'm going to try give about 30 minutes total to this segment, so you can really get to know each other in the room, and get to speak with our speakers a little bit more intimately. So these are really for you to broaden out your community and your network, assuming you're all working within the health space. So is there something that you need guidance on? Is there an introduction to someone that you're looking to get that perhaps someone else in that room can provide to you? Or do you have a piece of advice for someone else in the room that you can lend a hand to? So these are the networking breakout sessions. I keep getting feedback to make them longer and longer. So we'll do about 30 minutes today and see how that goes. Okay, so without further ado, I'd love to meet you, the attendees. So I'm going to start with Anne-Laurie.
Hi, Isabel. Hi, everyone. Can you hear me?
Yes.
Yeah. Okay, good. So my name is Anne, and I'm from New Brunswick, and my business is Tri-Coast Education. So essentially, we have developed and implemented a language assessment that can identify children with language disorders a lot faster and more accurately, and it's specifically important for children who come from culturally and linguistically diverse backgrounds, because current assessments are not created for them and they are often misdiagnosed. And so we also provide educators and speech language pathologists with professional development so they can use the assessment and continue capacity building in that area. Well, thank you.
Fantastic. Thank you so much, Anne. And Anne is our New Brunswick representative for our Startup Women Advocacy Network. I'll put a link into the chat if anyone's interested in learning more about Anne and the Startup Women Advocacy Network as well. So thank you so much for joining.
Thank you.
All right, we've got Annie Lou.
Hello everyone, Annie Lou Saint-Amand. I'm in Montreal, so hi, bonjour tout le monde. I actually maybe the black sheep in the room. I actually come from management consulting. I have 8 years of experience with McKinsey and Company, and my work has focused really on consumer-facing industries, both in healthcare but also in retail and other industries. And I'm actually interested I'm making a pivot to focus on women's health. Most interested about digital health and looking at a few different options, both in the menopause space, yes, Rachel, and in the fertility space. And so I haven't quite made up my mind yet if I want to start my own business or if I will be joining a startup in this space. But I'm here to learn more about what all of you are doing and advance my own reflection as to what I'll do next, professionally speaking. So nice to meet you all.
Wonderful. Thank you so much for joining. And I feel like Rachel might be a fantastic person for you to chat with.
Yes, actually, Rachel and I have been in touch in a few different contexts.
Fantastic. Thank you so much.
Thank you.
Okay, next up is Suze Mason from Sprout Family.
Hi, everyone. I'm Suze. I'm out of Toronto. Sprout Family is a fertility and family building benefits company. So we're working with Canadian employers to improve access to fertility, surrogacy, and adoption care for their employees. So we have a virtual care platform to help them navigate any pathway to parenthood. And then we do the benefits administration so they actually have coverage from the financial side as well. And yeah, excited to connect with everyone. Honestly, I just want to talk with other people in the space and good to see some friendly faces on the call as well.
Thank you so much, Suze. Next up, we've got Stephanie Chan.
Hi, everyone. I'm Stephanie. I'm out in Vancouver. I'm the founder and CEO of My Carebase, and we are a senior care platform that has two main components. One is the tech-enabled marketplace that has algorithms to match families who are looking for caregivers with vetted, pre-screened caregivers for hire who are looking for work. And this is all to support aging parents at home. So we're focused on senior care. The second component of our platform is a care management app, so that once you hire the caregiver, you have a tool to monitor that care from wherever you may be around the world.
Wonderful. Thank you so much for joining, Stephanie. Next up is Alana from MotoPal.
Hi there. Yeah, my name is Alana. I'm an occupational therapist. I've worked in the mental health space for over 20 years, and I'm developing a safe driving app for people with neurodiversity, particularly ADHD, and trying to make driving more accessible for people. So I'm just happy to connect and learn and grow. So yeah, thank you.
Wonderful. Thank you so much, Alana. And for those who are just joining, we're doing a quick roundtable introduction of all of our attendees here today. So you can either jump on screen and I'll call on you to introduce yourself, or you can do it in the chat, whatever you're most comfortable with. Next up is Maxine.
My name's Maxine Holland. I have a private home care company located in Belleville, Ontario. I'm also a second year RPN student. And we do private home care, filling the gaps that have been created since the downloading and changing of healthcare in the community.
Wonderful. Thank you so much for
I've been in
joining.
business just 5 years.
Fantastic. Thank you so much. Next up, I have Angaja.
Hi, I'm Anjeza. My company is called The Consulting Nest. So I actually have created a marketplace for vetted and seasoned public health professionals. So actually, like many of us here that work in public health and healthcare. And I coach folks that are professionals in the healthcare space to become consultants and share that knowledge broader as a consultant on different projects and initiatives across Canada and the US. And my marketplace is a startup. So it's a platform where organizations can come looking for those seasoned and vetted consultants to work on projects with them. So when I say like consultants, they do have to be high level. They have to have at least 5+ years of experience. And for most of the time, they do have to have a master's degree or above. But we definitely have nurses on there, environmental health officers, and licensing agents, things like that, that are all based around healthcare and public health.
Wonderful. Thank you so much. Oh, wonderful. We got someone else coming on screen. Temu, you came on screen for a moment, but if you want to introduce yourself in the chat, that's absolutely fine. Let's see, we have Punita.
Hi everyone, my name is Punita Burgawa. I'm based in New Brunswick, and my company's name is Stream Breeze. And Stream Breeze is a revolutionary candy that helps to strengthen the digestive process by activating the secretion of digestive juices. This is a candy that's all plant-based. There's no sugar or any artificial ingredient in it. So it really is a very good candy if you eat after dinner, and it helps to prevent your bloating, burping, and heaviness. So I'm in the process of making this candy and making people overall appetite better.
Wonderful. Thank you so much, Punita. Marcia, if you'd like to introduce yourself.
Hi there. My name is Marcia Haynes, founder of IUTA Health. This is an early stage company offering digital health solutions for people living with multiple chronic diseases, more specifically those in the low income strata. We are in pre-launch with our self-serve application, which enables people to manage medications, doctor's appointments, symptoms, and readings. Really just collecting sort of their own electronic medical record in their phone for less than the price of a cup of coffee per month. Thank you for having me.
Wonderful. Thank you so much, Marcia. Karen, you're up next.
Hi, I'm Karen. I'm a nurse practitioner out of Alberta. I have a medical aesthetics company right now doing Botox filler. But I'm looking to expand into a new vertical to do hormone therapy. I'm certified through NAMS, but also through WorldLink for various types of hormone therapy. And so, yeah, just really looking, I'm not a business person. I'm very clinically trained. So looking to get some business tips out of this.
Thank you, Karen. Next up is Alexia.
Hi, everyone. Great to meet you all. My name is Alexia. I just finished my PhD in biology at University of Ottawa this year. And me and my coworkers spun out a pharmaceutical diagnostics company. We're called Yellowbird Diagnostics, and we make new medical imaging dyes to address patient populations who need earlier diagnosis of disease.
Wonderful. Thank you so much for joining. Alrighty, is there anyone else that would like to come on screen to introduce themselves before we head into our entrepreneur expert talks? Yes, go right ahead.
Hi, afternoon, everyone. My name is Tamia Clark. My business is Money Moods Counseling. I am a registered counseling therapist in the beautiful province of Nova Scotia. I provide services to children, teens, and adults. I primarily focus with play therapy interventions, which help little ones in processing their feelings. And I also work with adults with ART, accelerated resolution therapy, to help with trauma. Wonderful meeting you all.
Wonderful. Thank you so much for joining.
Maybe I'll go.
Emma, yeah, go right ahead.
Sure. Hi, I'm Emma. I'm a neuroscientist by training and a software engineer. I have a company called AIMD. It's an AI-driven diagnostic solution so that retailers of health and wellness brands can recommend their products better using actual biometrics of their users. It's great to meet you guys. If anyone has a retail wellness product, feel free to reach out. I'd love to chat.
Thank you, Emma. And Jessica, if you'd like to go ahead.
Hi, morning, everyone. I am saying hi from Whistler, BC right now, and I'm the founder of Alter Ego Health, which is an online menopause clinic, which launched last February, and we're reshaping menopause care with a holistic approach. So we are leveraging a telehealth model with prescribing naturopathic doctors who are MSCP, NAM certified, and registered dietitians.
Wonderful. Thank you so much for joining. Thank you to everyone that came on screen to introduce themselves. I also see a bunch of people introducing themselves in the chat. So that's great. If you want to share your LinkedIn's, websites, make sure that you're connecting with each other in the chat as well. Alrighty, so I'm going to pass it over to our speakers to give us a little bit of background on themselves and their business so that you can kind of understand who they are. So firstly, I'll introduce who the speakers are. Speakers maybe can give a wave when I introduce you. I have Ariel Dalfen. She's the co-founder and CEO of BRIA. And Rachel Bartholomew, CEO and founder of High IV Health and a founding member of FemTech Canada. So Ariel, I think I'm going to have you kick things off to tell us your story.
Sure, happy to. I'm really happy to be here, and it's so wonderful and inspiring to meet all of you, to hear what you're all doing. Everybody on this call knows how hard it is to take nothing and build something. And so I think it's great that we're all here together and sharing and learning. And I'm honored to be here and to be sharing the spotlight with Rachel today. So as Isabel mentioned, my name's Ariel Dalfen. I'm a psychiatrist of about 25 years. And for most of that, I was working at a major academic hospital in downtown Toronto, specializing in women's mental health. I was running our women's mental health program at Mount Sinai Hospital for many of those years. And over that time, got a very strong sense of how the public healthcare system works, how to help people, and what was really missing in the healthcare system for women who are struggling. And so together with one of my very long-time psychiatric colleagues, Dr. Bev Young, we always had a dream to build something better for the people who we were seeing and for their families. And so we started doing telemedicine actually via a grant that we got in about 2013. So by the time the pandemic hit and everything went virtual, plus there were some things happening in our personal lives and our ages, and we just thought, okay, it's now or never. We're going to take the leap out of the academic healthcare system and into entrepreneurship. So Bev and I and our third co-founder, Emily, put our brains together. We were busily working for about a year. Then we launched BRIA in May of 2022. And I'm happy to get into it a little bit more later, but basically what we do is we're a one-stop shop platform for women and their partners who are dealing with mental health and hormonal health issues across reproductive life stages. So we see people who are trying to conceive, going through fertility, those who are pregnant, postpartum, and perimenopause and beyond. And we bring all the services that we know people need at those times. So everything from individual therapy, couples therapy, sex therapies, to more in-depth mental health assessments, hormonal assessments, ADHD assessments, sleep, nutrition. And so we try and bring all of these services to people and to their partners to really make their lives a lot easier at a time when people are struggling and there's so much at play in terms of their stresses and finances and time needed for other appointments. And so we've been in business for about 2 years now. We're open in Ontario, we're open in Alberta, and we're also expanding across Canada. So I'm happy to be here, share anything that I've learned along the way, and I'm looking forward to our conversation today.
Thank you so much, Ariel. And yeah, looking forward to diving into all that expertise that you've garnered over the last 25 years, you said. So yeah, lots to learn from you, I think. Rachel, over to you to tell us your story.
Amazing. Thanks for having me, and lovely to meet everyone in the room. Some amazing women here, and the stories you guys have is just incredible, and can't wait to chat further. So I'm actually in Calgary right now, but I'm about to head to the airport after to go home, which is Kitchener-Waterloo area. I've been working in the startup space for quite a while now, over 15 years, doing various roles from running incubators to my own startups, to, you know, running innovation teams, etc. When I was 28 and finishing up my term at Wilfrid Laurier running their startup incubator, I was actually diagnosed with cervical cancer. And during that time, I was handed a device that was going to be my downfall for the next 5 years of my treatment recovery. That was 84 years old and created by a man back in 1938. And it was so inhumane, and I couldn't believe that this was standard of care across all of the cancer centers. I was like, somebody's got to innovate this. So to keep my brain busy while going through cancer treatment, created Hy-Vee Health, used my then subsequent treatment and being in the hospital every day to validate that idea. And we were off to the races, and unfortunately COVID hit. So it was an interesting time trying to innovate a medical device during a time when none of us could meet in person or even get access to a lab or hardware space. So spent about a year really digging into what I call is the conspiracy theory of women's health. We know nothing about women's health. The research is about 30 years behind because women were not required to be a part of clinical trials in Canada until the early 90s. And I just said, okay, I am going to pull my socks up and, you know, really do the fundamental research that we need for this device. So what we've created essentially is a replacement for the vaginal dilator. We've created a device that does multiple therapeutics, but also has a number of biosensors integrated in, and it's an at-home use device. So we call it the CPAP machine for gynecology and pelvic floor. It's been really interesting since integrating in sensors. We realized nobody has stuck sensors in the vagina before, and we're finding out all sorts of really interesting information that's leading towards diagnostic capabilities. So I am on a lovely regulatory clinical trial medical device journey. I've been doing this now for 4 years. Through that process, I started raising money, realized I couldn't find my people. I couldn't find my women's health companies. We go through really, really challenging stuff when it comes to raising money, and I wanted to bring them all in a room. I found 51 of us across Canada. I got us in a Slack channel, and we just started meeting. And that has now rolled into what is FemTech Canada. We support 136 companies and counting, and I just met a new one in this room today, so I'm super excited to connect with you. But essentially, we're bringing resources for women's health innovators across the country. There's 136 of us. You're in good company if you want to join us. And we're currently pulling together a $100 million ask from the Canadian government for women's health and research and supporting innovators and just moving that needle to the next stage that we all need, want, and deserve. So that's a little bit about me.
Amazing. Thank you so much, Rachel. And I love the work that you're doing with FemTech Canada in advocating for women's health across the board. I think, yeah, it's time. It needs to be addressed and updated and listened to as well. So amazing. All right, so we are going to go into our panel discussion session where really we're just going to kind of dive into all the kind of starting points of and growing pains of growing your business within this space. And you'll hear me say it a few times, but please feel comfortable to ask your questions. We're here for you and to support you in your business. So whatever your question is, please feel free to use the raise hand function and ask on screen, or you can ask in the chat and I can ask on your behalf. I have some questions that I've drafted that can maybe like get us going, get us a bit warmed up, but would love to hear from you, the attendees, on any questions that you have that are pertaining to your own struggles or questions that you need answered. So we'll kind of kick things off with sort of the general question of challenges. So Ariel and Rachel, what were some of the biggest challenges that you faced when you were starting your business within the health space, and how did you overcome these? Or perhaps it's still something that you are overcoming. Ariel, maybe I'll go to you first.
So to answer the last part of your question first, yes, there are daily hurdles to overcome. And but that makes it both exciting and that makes it stressful. And it makes it very creative. And yeah, I wouldn't change anything for the world, but it's a hard journey starting a business, and it's a hard journey being an entrepreneur, and a female entrepreneur even more so. So I'll preface it with that. I think specifically what, gosh, I could talk all day about this, but some of the early challenges we faced were basically because we are healthcare services and we're an MD owned and run business primarily with all certified healthcare providers. It is the regulations. So any of you here across Canada know the healthcare system in Canada is extremely challenging. It's extremely highly regulated for good reason, but it also makes it tricky. And so navigating first of all, as an MD owned business, and what we could do, what we couldn't do, navigating in general in the healthcare system in terms of we're sort of a quasi private and public. We cross and we cover and offer services that are both public and private facing. So navigating both those worlds, and the privacy and the legal and the compliance stuff, those were just like time consuming, financially consuming, and stressful, to be sure that we were doing everything absolutely by the book. And because we're dealing with people's lives and we're dealing with safety. And so really making sure of that. Those were some not unexpected challenges, but definitely very consuming and costly challenges. I think some of the other things that we faced were dealing with some people, like when we started to talk about, we're currently bootstrapped. We have a profit base because we are a services business, and we do make money from our services, which we pour back into our business. But when we have taken a lot of meetings with potential investors and funding agencies, and I'm sure some of you, and especially Rachel, can relate to this, but when people hear women's health or women's mental health, like, you get a bit of an eye roll, and you get a bit of, why is your product so niche? And why is your product only serving half of the population? Or why is your product only, or your service, why are you only doing this? When are you going to do that? And so that's kind of deflating and very demoralizing when you're so excited and you're in this and you know why you're doing this. It's because people are very underserved. People have a hard time accessing whether that's a product or whether that's a service. as it is, and you're trying to make a big difference in this space. But so some of that public interface or some of those conversations are definitely challenging and demoralizing, because I'd say as an entrepreneur, and especially in this space, it's like you need to get up and you need to have so much energy and enthusiasm, and you're kind of putting out fires on every front every day. And so that can be a little bit deflating and definitely takes like a lot of like pushing through. So that's a bit, that's definitely a bit of a wind in our face, or a bit of a barrier, I'd say, and has been challenging. And I guess the second part is how we overcome those, are just really, sticking to our mission, being very passionate about our mission, focusing on the successes we have achieved, and learning to talk to people who are supportive, finding support, whether that's financial or whether that's just for what you're doing, and cheerleaders in little spaces along the way, in separate communities that you can find among friends. For me, that comes a lot from our co-founders, from our other team of healthcare providers. We have about 40 people now who work with us, and everybody's really determined. So we share a lot of that amongst ourselves. And I think that community and that support is very helpful for the morale that you need to just keep on going every day. And then otherwise, like realizing this is a learning process, and when we face barriers like some of the legal or the privacy or the things that we had no idea because we'd never run a business before, all of us, and learning and making mistakes and just allowing ourselves, which is, I don't want to overgeneralize, but that was hard. Like, it's hard not to know something and to not try to want to get it right the first time. And we do want to get it right the first time, obviously, but there are things which we're like, oh, we made a mistake on that. And like, just like having to shake that off. Sometimes you have to pay the bills that are maybe higher than you expect, or, and it's like, you just have to accept that. And that was hard for me as a physician and professional. And like many people here probably, we grow up and maybe we have perfectionist traits, or we want to do things right, but it's like, you are not going to get everything right. So that is a very different mindset of like bringing the beginner mindset and accepting that you're a beginner as an entrepreneur. For me, that was really, really hard. And for our team, that's been hard, but something essential, because there are so many mistakes. So that's me blabbing on. I'm happy to answer any questions about that after, or to just pass it over to Rachel.
Thanks, Ariel. And yeah, I mean, I definitely feel like we can also sit here and talk about the endless challenges that there are for going into the space full stop, but then also adding the additional layer of being a woman, and then even further additional layers of various other different demographics as well, so there's many kind of hurdles that can be faced, and it always makes me eye roll deep when I hear the whole it's for like women's health, it's a niche audience, and you kind of just want to laugh at it, but it's very frustrating to hear. And I hear a lot of women within that space say the same thing, that's a lot of what they hear in the initial parts of their business.
Can I just add one more thing to that? Like, even if it is a niche business and someone else deems it a niche, like that's still very valuable. And that's still, there are people who are going to find a lot of value in that niche. Maybe not like a VC, but there is value. And sometimes that can feel like it's being undermined, but I would say it's hard. You don't want to let that stop you if you really believe in what you're doing and you see, the financial benefit potentially, or you've dedicated yourself to that. Pursue the niche.
Yeah, love that. Absolutely. Thank you so much. Rachel, how about yourself? Challenges and how you've overcome them?
I think Ariel shared a lot of what we all experience. I mean, I think this audience is getting a very heavy femtech lens, women's health specific lens, but I know a lot of you are not just in women's health, you're in all health. So, and Maxine's been in the chat, regulations, huge challenge, especially if you don't come from this world like me. I'm just a patient with an experience. So I've been learning the clinical trial process. I've been learning, ISO 13485. I've been learning FDA and Health Canada. I've been fighting with Health Canada for months. So, you know, it's definitely a challenging process that it's really important to have the right people around you to guide you. Insurance, like Maxine said, reimbursement, accessibility, you know, a lot of what we create, unfortunately, in healthcare often doesn't have a pathway for procurement, doesn't have a pathway for reimbursement through insurance. And so, what does that call on? That calls on women to take out their checkbooks and to pay out of pocket. And not every woman can do that. And only a certain percentage of the population can actually do that. So, how does accessibility, especially for populations that may not be able to get access, you know, how do we advance healthcare in that sense, right? So that has always been top of mind for what we have created. You know, Maxine also said financial and human resources. I mean, growth and managing team. And I mean, being a leader and just understanding what kind of leader you want to be. Managing a team of people that all have different reasons for why they're there, right? These are all things that you struggle with as you grow. And you know, Ariel's fundraising and kind of talk about financing and finding funding, it's very real. We've raised 5.5 million or so. And you know, I have heard everything come out of the mouths of our lovely male VCs and angel investors. And unfortunately, that's usually who we're pitching to. And unfortunately, they don't have a vagina. They're never going to understand what we're dealing with. And so, you know, trying to connect on that, it just takes that many more conversations. The amount of wives, mothers, daughters that I've had to talk to validate my idea with a male VC, just in order to get them to consider. There's a huge education piece to all of that. So, you know, it's definitely challenging, but it's not without its huge rewards. And I think it's just, you know, continuing to find the right people, find mentors, find people who can guide you through that process. It's the most important piece. I think the other final thing I'll kind of say is essentially accessibility in Canada, procurement, the healthcare system, as much as it's free and it saves our butts in a lot of situations, it's also very challenging for innovators to break through. And this is something that hasn't been solved yet. And there's a lot of us that are trying to solve this. So if anybody is interested in connecting on this and connecting in, to try to bring these conversations up to the government level, to start figuring out how do we get more innovations adopted in Canada so that we all don't just move to the US and focus on the US as our first market. So.
Thank you so much, Rachel. Very holistic viewpoint on the many different challenges that anyone faces just on the wider scope of health. I'd love to kind of go back to your point about not coming from a medical background and, you know, the fact that you yourself saw the need for this and you were like, well, if someone has to do it, I may as well do it myself. Can you talk about what it's been like building this business, going through the research and you know, the clinical trial process without all of this knowledge and background that someone in the medical field might have?
For sure. So definitely has not been without its trials and tribulations, and maybe a couple mistakes along the way, you know, and a couple of, you know, approaches to Health Canada or the certifiers when maybe we weren't ready to go there and got our kind of butts handed to us. And I'm saying that lightly. So, you know, and Ariel mentioned it's there for a reason, right? It's there to protect the safety and the efficacy so that there's products that come through that are medically sound and relevant. And it was really challenging early on for me to make that decision because it is scary as hell. I mean, when you my initial thoughts about what the FDA was, oh yeah, they just make sure that everything works properly and works for patients. And it's like, no, that's not it at all. They want to make sure that it's safe. Oh, and by the way, if you don't properly document and report things that happen, you can go to jail. And I'm like, jail? Like we don't get another thing in between. So, it's a scary thing to kind of go down, but I made the choice very early on in our company, and it was not made lightly because investors are pushing us, go direct to consumer, make me my money back, go that direction. But I actually had a couple of them go, well, sell your company to Goop and just get it out there like hotcakes. And when I thought back to the core reason why I created what I created, when I was diagnosed with cancer, I was not turning to Gwyneth Paltrow to help me with my cancer. Like, I'm sorry, Gwyneth, but it's just not a thing. So I was turning to my oncologist. I was turning to the people who were in charge of my care, that were going to get me the fundamental care that I needed, and then go out and explore all these alternative ways that I could also support that care. So I wanted to create something that was going to not just sit in a drawer. I wanted something that could be accessible and affordable to patients, that had the doctor have accountability for that patient, because I'm sure all of you in this room know doctors are the first people to go, I did my job, it's up to you now, or go on, do your thing, go to this referral, let me push you to this prescription, whatever it is, right? So I wanted to make something that was long lasting and had the doctor integrated in. And that meant going the regulated route. And when I started going that route, I realized very quickly that what we were regulated for was so limited. And so it's like, okay, now we got to do clinical trials to expand what that looks like. So learning that along the way, of course, has had a lot of ups and downs and a huge learning curve. Getting the right mentors in place, I realized very quickly that your team that you start with usually is not going to be your team that you grow in with and grow into when the stakes start getting higher. And so bringing in those heavy hitters that really understand this game and the ways to do it right was very important for us. So still on the journey, still learning, still going through that process, and we'll see where we go from here.
Thank you, Rachel. And Ariel, you're sort of on the opposite side in that you have that medical knowledge and experience. Was that very useful to you in building this? And if so, what should folks with non-medical backgrounds be prepared for? Or were there any surprises to you that as you built your business?
Yeah, so I would say 100% it was the reason that we had the confidence to do what we were doing, having that medical information, having the clinical knowledge, the deep clinical knowledge, the clinical expertise, the networks, the reputation, if I can be so bold, having that gave us the confidence to start. Now, that is not everything by any stretch. And we knew, and just like any team, to Rachel's point, there are going to be gaps on any team. So whether you have the deep medical knowledge or an MD or a healthcare professional, you're still going to need all the other people with the accounting, the business, the tech, et cetera, et cetera. So I think there's no perfect team, and you have to figure out, where are your limitations? Who else do you need on your team to make your business a success? So we learned that just because we have all that expertise doesn't mean it's going to be a successful business. It can be a successful clinic, but that doesn't mean we're able to expand across Canada and be, the women's mental health care providers that we want to be for all Canadian women and their families. Like, that takes a lot more of a different strengths and different experiences. So we've been assembling that team, and in part working with people in contracts to fill a lot of those gaps as we move along, and as we identify certain needs along the way. So it's something, but it's not everything. And I think that's probably true with almost any founding team, that there are going to be gaps and you need to figure out how you want to fill those commensurate with how you want to build your business and what kind of business you want to have ultimately.
Mm-hmm. Thank you so much. Yeah, it's definitely a case of you don't know what you don't know, and recognizing that and bringing those people in who their strengths lie in those areas, those pockets that you're unfamiliar with.
Exactly.
Yeah. And Rachel, I know that you mentioned you've I think it was 5.5 million you said you've raised. First of all, yes. Can you talk a little bit about what that experience has been like, and from researching and developing relationships with these people, and then getting that funding and that just that entire process for anyone who's looking to go down that path of funding.
Sure. I mean, not for the faint of heart by any means. Not a fun process by any means. Fundraising's a full-time job, and it takes you away from your business. And, the fundraising piece is one piece, and then it's managing that piece after that always comes down the road, right? So I've really found that having the right team in place to help, because you really move out as a CEO of operations and you let that go to your team, and you are a 24/7 fundraiser at that point. So we did a pre-seed round of 1.3 million in 2021. We did it with a prototype and not knowing a lot of what we were doing. And I think that kind of showcased the mentality back in 2021. There was a lot of dry powder. There was a lot of people that were just throwing money everywhere. We were in the midst of COVID. It was a different world. Then Silicon Valley Bank blew up, and the whole world changed. And so we are now just closing our 2 million seed. Wish it was more money. It's taken us 18 months to close this. It has been extremely painful because a lot of people don't know what they're doing right now. They've run out of money, they're in between funds, they're changing their strategy, the pressure's coming down from LPs. It is a different environment. I am lucky to have a very amazing group of investors who've constantly reinvested in us to keep us going and to get us to this point. But I will just say, back in 2021, it took about 60 no's to get to my first yes. Now in this environment, it took about 250 no's before the first yes. So just imagine the amount of meetings and emails and CRM and everything that you're doing to keep up with that. It's tireless, it's endless amounts of negativity, and it's tough. So my advice is always try to go the route you can without going for investment. You do it when you need to, when it's absolutely fundamentally necessary. We are very lucky, and I saw some people commenting about, first in human clinical trials in Canada and, doing work in Canada. We've got, I think the one thing that's keeping me here is SHRED, right? We've got these amazing programs. We've got funding that unfortunately dried up in the last year, but is now coming back from the government. Get that non-dilutive funding. We've done about 2.4 million or so in non-dilutive. It's out there. It's there to support you. I think for women, there's a lot more that's starting to come out with that. And I think that support's going to continue to grow and change and adapt. But really doing that innovation work here is so fundamental to getting access to that program, specifically SHRED. And it's been a lifeline for us. So.
Thank you so much, Rachel, for bringing us through that. And yeah, I completely agree. If you can secure grant money, it's free money that's there. There is some work that goes into it, but it's yeah, definitely worthwhile. Marcia's curious, Rachel, did you raise your investment in Canada?
Yeah, great question. So I was fortunate enough to do the majority in Canada. I think I've talked to every VC and angel investor in Canada at this point. I know exactly what they're all doing now, and I've leveraged the hell out of what I could. I have some US, I have some European as well. I am very much at the point now where I will not be raising my next Series A funding in Canada. It's a little bit too dry here now. So I have been fortunate enough to do Canadian funding up until this point for the majority, but now we'll be kind of shifting my focus.
Thanks, Rachel.
Thank you. I just want to add, or just pick up a comment, maybe Rachel knows the answer, but I think, Isabel, just to pick up a comment you meant about free money, I think that's a bit of a misnomer, because with a lot of these grants, there is the requirement that you have to pay back or pay back a certain amount, or so I just want to, maybe you can speak to that, or maybe Rachel can speak to that, but I do think it is a bit of a misnomer, because I don't know if Rachel, you want to comment about that, but it can be quite shocking as to how much, if you're looking for help with the applications or with specifics of the fine print in terms of what you actually have to pay back, it can be very daunting.
Yeah, a lot of the stuff that I go for is not payback model. So, and I know there was a comment about non-dilutive programs and grants. So, IRAP being one of them, Sophie Healthy for clinical trial work, OCI. A lot of these programs don't have that payback model, but there's obviously caveats around it, right? What you can use it for, and you have to get creative, okay? You have to be creative with this. One of the things that we do as women is we self-identify out of things. And I'm telling you all now, do not do that. If anything, self-identify in and get creative. So some of the stuff that we've approached is things like aging population. We know that we have an application in menopause. We're going down that pipeline now. A lot of these programs don't know how to deploy this funding. I probably shouldn't be saying this out loud, but they've got these huge pools of money to deploy and don't know how to deploy it and don't have enough access to companies that are working in this space. So I'm telling you all now, go out there and identify something that you're like, I don't know if I could fit into this. Just do it and see what happens. Because I am noticing now that there's a lot more need, especially in the life sciences and health space. There's just not enough of us to go around in Canada to fill these funding pieces. Always be wary of what you have to pay back. Always be wary of especially loan programs around self pieces that you have to put up in order to cover that money. I've heard horror stories with a lot of those kind of programming, and be very wary of equity-based funding. Don't give your equity away. It is so valuable for your company. And someone who's giving you $50,000 for 5%, tell them to take a hike. You can go find that elsewhere and not have to get 5% up of your company. Always be extra challenging with each one of those pieces.
Thank you so much, Rachel. And Ariel, yeah, great. It was a great point there. It's not necessarily the free money, but sorry, I feel like you have a follow-up.
No. I'll finish up, and then I just wanted to add something.
No, yeah, go ahead.
Just on the tail end of what Rachel was saying, like we did not go the funding route after many conversations and people wanting to get too much for too little. And we just thought also, okay, we haven't dug deep enough within our own networks and our own resources, including building on our previous professions and our professional networks. And I think, again, I don't want to generalize, but often women feel, or I know I felt, especially coming from the medical world, I was a terrible networker. I still probably can learn a lot, but I've become a lot more, I guess, shameless about approaching people, about reaching out to people, about asking people for help, about, you know, really digging into that network to see how people would be able to assist us at BRIA. And, you know, I get inbound requests all the time, but I was never good at the outbound requests for either time or professional advice, or I was never good at asking for that. So that is another thing that I've really learned and relied upon in order to help grow our business. And we decided, after many conversations with investors and angels, to decide, okay, like, we're sitting on a lot of potential here that we haven't tapped, and the timing isn't right, and we don't want to dilute our ownership. So let's really see how far we can push this on our own and sort of shamelessly plug ourselves, reach out, connect, and network. So that was not something that came easy before, or something that were innate skills. So another thing, don't take yourself out of the running in terms of who you know, what you know, and like just being creative within your own networks if getting external funding isn't exactly where you are at this point.
Excellent advice there, Ariel. Yeah, absolutely. We did an event a couple of weeks ago in Langley, and one of our speakers said the number one beneficial thing for entrepreneurs to do is networking and getting out there and meeting people. You never know what's going to come out of a conversation, and whether it's monetary or they are introducing you to someone else, it does help to build that community around you to help you in any way that they can. I've put some links into the chat there. So one is Granted Consulting. They're fantastic in helping you find grants. I know that Rachel put in Hello Pocketed. They're also a fantastic platform to sort of bring all the grants that are applicable to you and your business. I believe you can hire their grant writers as well to help you with writing the actual grant application. And then the Business Benefits Finder, always a great one to use. And then one of our partners, WEOC, they are doing a loan program. So that is a loan, you do have to pay that back. But they have, I think it's around $50 million they need to give away this year. So they have quite a lot of money that they're looking to deploy. And to your point, Rachel, yeah, they need support from other organizations to get that funding out. So definitely worthwhile checking those ones out as well. I realize I've asked a lot of my questions, and I really want to ensure that our attendees are getting their questions answered. So please, if you have any questions at all for our speakers, if you feel that you can add something to the conversation, please don't hesitate to come off mute. But want to give the opportunity if anyone has a question that they'd like to pose to the group. Punita, yeah, go ahead.
Yeah, I have a question. Like, once you were just starting out your company, what challenges did you face in forming your company? I know you had a good support with your team, but did you face any challenges when you were forming your company? What legal requirements were there, or what we should be aware of, like, any contracts or anything like that?
I can jump in on this one. So I've done this a couple times, and I think there's stuff that I still messed up on, even though I learned the hard way. I think the first and foremost is, if you have any IP, do not go out and share that IP until you have something in place, like a patent. And that, I mean, that's more for deeper tech, science, hardware related stuff, and making sure that you have that piece covered and that you have IP assignment agreements so that you are the owner of everything that is created within your company. I think that's kind of a first piece because that can get really tricky. Always, always, always lead with NDAs, lead with contracts, lead with all of those things before anybody starts. Be careful who you get in bed with very early on. It might look glamorous when you're just starting out and you're like really excited about the idea and you're doing it with somebody else and you're like, oh yeah, we got to formalize this company. Oh yeah, we'll just go 50-50 and we'll just sign this little piece of paper. And this little piece of paper does not hold up when, money starts coming into the account and really changes the way that people act. Like money really truly changes the way that people are motivated and how they interact with your company. So, I will be honest with you. I went through a lot of hiring and firing through my company, and I've been sued twice. And, some of these pieces can be avoided when you have good lawyers. I know that we all look at lawyers and we're like, oh my goodness, I could just do this myself. And, I could just register my company. And you don't realize that, yes, you can register your company, but there's so many things that you can do wrong that then can bite you in the butt when, money starts flowing. You have customers, you have investors, you have all these things when it wasn't set up properly from the beginning. So you will pay for it down the road. So as much as I hate to say it, like get a really good lawyer and spend the money up front and it's worthwhile. And don't bring anybody into the company without agreements in place. Talk to other, entrepreneurs, see if they will send you their agreements. I happily share my agreements. Hopefully my lawyers don't listen to this, but I share them with other people just as templates to build off of that are, Ontario standard and up to snuff with a lot of the legal stuff that happens in the courts and pieces that have to be layered in. So, those are really, really important pieces to have in place to protect yourself. You're protecting yourself and your organization.
And I fully agree. I totally agree with everything that Rachel's saying. And I would just add one more thing. There are a lot of, you don't, especially as a startup, need to spend money on big Bay Street law firms who offer entrepreneurship programs, et cetera, et cetera. Talk to other people about like good, small little boutique firms. You don't have to pay for their overhead rent in downtown Toronto or their fancy offices. You want someone with good experience with entrepreneurship and with the type of maybe in the niche of the area that you're in, and don't get seduced by the fancy offices with the Ed Bertinsky photos all over the walls. And, be very thoughtful about who you're, because those are huge fees that you're going to end up spending. Yeah. And you can probably get amazing, very focused, very useful and experienced advice without having to spend the huge bucks. So just do your homework on that and talk to other people. It's another place where having a network of like-minded entrepreneurs is extremely helpful.
Thank you. That's very much helpful for me because soon I will be starting my company. So that's a really helpful suggestions given by you, and I really appreciate that.
Excellent question, Punita. Thank you so much for coming on and asking that. I have a question from Alana. They're asking, is there a legal hub? They're on the West Coast in BC, looking for recommendations for someone experienced in developing apps. I'm not sure if that's something that either of our speakers can talk to. Alana, I am connected with someone who has a business in helping people build apps that aren't tech, don't have a tech background. So I'll add my email in if you'd like to email me about that, and I can connect you with her. Let me just see if there was any questions that came through in the chat. Okay, I don't think I missed any, but we will go into our networking breakout room shortly. So I want to ensure, are there any questions that you'd like asked before we get into those? Where do people want to get in and meet each other and network? Oh, I think I saw someone put their hand up.
Yeah,
Sad,
it's
yeah.
me, Satna. Yes. I formed my own for-profit company, and I'm very good in engineering and IT app development. I'm very good in doing the research, and so I already have several products in with me, service oriented and the other kind of product. But I don't know how to go. I know that many fundings and different things are happening. Could you please tell me where to start? Because I exhausted my own funding, which I got my family and myself. And now I'm thinking to how I will go in Canada. Actually, it is a little bit confused. But other than that, all the steps I passed.
Yeah, I could jump in here. And I know there's a couple of people commenting about legal hubs in different areas. So I'm going to hit that first. So the best way to find a lawyer to work with your startup is to actually join or be a part of your local regional innovation center. Or join an accelerator or incubator. You will get the support of business mentorship and support, but they will also have a bunch of lawyers on deck that they can actually help provide advice for free. A lot of them have free legal counsel and resources that they can connect you to. But then yes, exactly, Maxine, you're stealing my thunder here. The small business centers that exist have these like legal happy hours and stuff where you can come in and sit down and get counseling and stuff. So, and a lot of them are smaller, so they're not the big, large law firms that it's a one-off person or a couple small firms that will help you at a reasonable price and have startup rates. So, yes, and good lawyer. There's a couple online tools as well that you can use to take a look at that. Now, Sedna, from your side, Maxine hit the nail there. The small business center, I don't know where you're located, but there are small business centers across Canada that actually have something called Starter Company. And Starter Company gives $5,000 grants, and it's a small program that gets you kind of set up and going and gets you a business plan and a business piece to kind of together so that you're ready and able to actually go out and raise more money specifically through the grant programs. So Starter Company is always where and there's the Plus program, exactly, Maxine, that I usually send companies that have never raised any money externally through government programs to, as a first kind of way to set you up for success to apply. Because once you've got all those pieces, applying to grants is literally just a copy and paste of the same information about your business over and over and over again. And you get really, really good at it. And you come to a point where it's really quick and easy to just get through them all yourself. You don't have to hire anybody, but you got to build that content first. So that program helps you. They give $5,000 away. It's free. There's nothing associated with it. It's just to get you kind of off the ground. So take a look at that. See if you can find a small business center within your region. And thank you, Maxine, for stealing my thunder and putting that right up front.
Thanks so much for taking that.
Thank you.
Yeah, and Sadna, I'm for the others as well, asking for recommendations or suggestions on options in terms of law. Ozeal Law is a law firm that we've worked with in the past, and they specifically help startups. So worth checking those out. And I see a few other people are in there. But yes, definitely getting to know your local business center is a great place to start. All right, so we are at the time where we want to go into our networking breakout rooms. So I have created some breakout rooms with about 3 to 4 people per room. And this is really to provide you with some intentional networking with each other, sort of like speed dating, if you will. Presumably, you're all working within the health space. So it's really a time for you to get to know one another. And, perhaps there's someone in the room that has a roadblock that they're currently facing, or they're looking for an introduction to someone, and perhaps you are that person that can support them with it, or you have that introduction. So it's sort of like an ask and an offer sort of framework for these networking rooms. So they'll be open for 15 minutes. And I also just ask to bear in mind, ensure that everyone in your room gets an opportunity to speak, gets to introduce themselves, and it's a collaborative, equal amount of time that everyone gets in speaking. You might have one of the speakers in your room as well. So if there was a question that you were hesitant to ask in this bigger room, perhaps you'll feel more comfortable speaking to them. So I'm just going to make sure that we have a good amount of people in each of our rooms. Alrighty, so I'm going to open them up, and I'll see you in there, but we'll come back here in about 15 minutes.